In last video, we started anti-tubercular drugs from chemotherapy unit 3. In that video, we have seen introductory part of anti-tubercular drugs, classifications, and the drug isoniazid in detail. So, in this video, we are going to continue the explanation about first line anti-tubercular drugs. Rifampicin. The drug rifampicin is from first line anti-tubercular drug, and mechanism of rifampicin is it inhibits RNA synthesis of bacteria by binding to the beta subunit of RNA polymerase. This is mechanism of action of rifampicin. Then contraindications of this drug. The patient who is suffering from diabetes, in that patient rifampicin is contraindicated. Then porphyria, in that patient this drug is contraindicated, and porphyria means over accumulation of porphyrin. Okay, then decreased blood clotting from vitamin K, in that patient this drug is contraindicated. Then patient who consume alcohol, in that patient this drug means rifampicin is contraindicated. Then the patient who having liver problems, in that patient this drug is contraindicated. Then abnormal liver function test and in jaundice, these drugs are contraindicated. Rifampicin is contraindicated. Then adverse effect of rifampicin, it causes heartburn, then upset of stomach and cramps, then gas occurs in GIT in stomach, then diarrhea, headache, drowsiness, fatigue, and dizziness are the adverse effect, that means side effect of rifampicin. Then uses of rifampicin. Rifampicin is an antibiotic which are used in the treatment of the tuberculosis, or this drug also prevent from tuberculosis. Then second use, rifampicin reduces bacteria in nose and throat which may cause meningitis or other infections. This is all about rifampicin. The next drug, pyrazinamide. Mechanism of action of pyrazinamide. This is also from first line antitubercular drug class, and mechanism of action of this drug is with the help of pyrazinamide pyrazinamidase enzyme. Pyrazinamide is converted to pyrazinoic acid, which decreases pH and retards growth of Mycobacterium tuberculosis and also inhibits fatty acid synthesis. This is mechanism of action of pyrazinamide. Then contraindications. Pyrazinamide is contraindicated in the patient with severe hepatic damage or who have shown hypersensitivity to the drug, or the patient who is suffering from acute gout. In that patient, pyrazinamide is contraindicated. Then the patient who having chronic renal failure, in that patient pyrazinamide is contraindicated. And in case of pregnancy and lactation, pyrazinamide is contraindicated. Then adverse effect of pyrazinamide. Nausea, upset of stomach, vomiting, loss of appetite, mild muscle pain, joint pain or fatigue म्हणजे थकवा येणे etc. are the side effects of pyrazinamide. Then uses of pyrazinamide. Pyrazinamide is used in the combination therapy with other drugs of antitubercular class. It used to treat tuberculosis, it is an antibiotic, so it works by stopping the growth of bacteria. It is used to treat only bacterial infections, not viral infections. Pyrazinamide हे फक्त बॅक्टेरियल इन्फेक्शन मध्येच यूज होतं, व्हायरल इन्फेक्शन मध्ये याचं यूज होत नाही. सच ॲज कोल्ड आणि फ्लू मध्ये पायराझिनामाइडचा यूज होत नाही किंवा आपण यूज करू शकत नाही. द नेक्स्ट ड्रग ethambutol. This is also from same class, first line antitubercular drug. And mechanism of ethambutol, listen carefully. It shows bacteriostatic activity by inhibition of arabinosyl transferase. Arabinosyl transferase is an enzyme that polymerizes arabinose into arabinan and then arabinogalactan, which is cell wall constituent of bacteria. Okay, then contraindications of ethambutol. Ethambutol is contraindicated in the patient who having hypersensitivity reaction to the ethambutol, and the patient who known with optic neuritis. Optic neuritis means inflammation of optic nerve. Okay. Then in the patient who are unable to appreciate and report visual side effects or change in the vision, in that patient ethambutol is contraindicated, such as young children and unconscious patient, म्हणजे बेशुद्ध पेशंट जे असेल अशा पेशंटमध्ये सुद्धा ethambutol हे कॉन्ट्राइंडिकेटेड आहे. Then adverse effect of ethambutol. Side effects of ethambutol is totally related to the eyes of the patient, which includes blurred vision or trouble focusing. ब्लर्ड विजन म्हणजे अंधुकपणे दिसणे, हे ॲडवर्स इफेक्ट आहे इथाम्ब्युटॉलचं. देन लॉस ऑफ विजन in only one eye that lasts for 1 hour or longer. Increased sensitivity of your eyes to light. प्रकाश सहन होत नाही, हे एक साईड इफेक्ट आहे ethambutolचं. त्याच्यानंतर लॉस ऑफ कलर विजन, म्हणजे जे कलर असतील ते ओळखू येत नाहीत किंवा व्यवस्थितपणे दिसत नाहीत, हे साईड इफेक्ट आहेत ethambutolचे. आणि कॉमन साईड इफेक्ट विच इन्क्लूड्स itching or rash on the skin, then joint pain, headache, dizziness, nausea, vomiting, stomach pain, indigestion, and loss of appetite are the side effects or adverse effect of ethambutol. Then uses of ethambutol. Uses of ethambutol is same as that of pyrazinamide. As we have seen that pyrazinamide is also used in the treatment of tuberculosis. In same way, ethambutol is also used in the treatment of tuberculosis, but in combination therapy. Then, as like of pyrazinamide, ethambutol is also antibiotic which is used for the stopping of growth of bacteria. Then, as like of pyrazinamide, ethambutol is used in only bacterial infection but not in viral infection such as common cold and flu. This is all about ethambutol. And last drug from first line antitubercular drug, that is streptomycin. Mechanism of action of streptomycin is very simple. It inhibits bacterial protein synthesis in 3 ways. First, interference with the initiation complex of peptide formation. This is first way to inhibit bacterial protein synthesis. Second way, misreading of mRNA, which causes incorporation of incorrect amino acids into the peptide, resulting in a non-functional or toxic proteins. And the last way to inhibit bacterial protein synthesis is breakup of polysomes into non-functional monosomes. This is about mechanism of action of streptomycin. Then contraindication. The patient who shows hypersensitivity reaction towards streptomycin, in that patient streptomycin is contraindicated, and the patient who shows hypersensitivity reaction with other aminoglycosides, in that patient streptomycin is contraindicated. Then severe hypersensitivity to sulfites, in that patient streptomycin is contraindicated. And concomitant live bacterial vaccines, in that patient, म्हणजे जो पेशंट लाईव्ह बॅक्टेरिया वॅक्सिनमध्ये सहभागी झालेला अशा पेशंटमध्ये स्ट्रेप्टोमायसिन कॉन्ट्राइंडिकेटेड आहे. देन ॲडवर्स इफेक्ट ऑफ स्ट्रेप्टोमायसिन इन्क्लूड्स nausea, vomiting, stomach upset, loss of appetite म्हणजे भूक न लागणे, स्पिनिंग सेन्सेशन मीन्स वर्टिगो म्हणजे चक्कर येणे, इंजेक्शन साइट रिॲक्शन विच इन्क्लूड्स पेन, इरिटेशन and redness of skin and tingling or prickling sensation in the face म्हणजे itching होते and rashes are the side effects or adverse effects of streptomycin. And lastly, uses of streptomycin. Streptomycin is antibiotic which are used to treat a number of bacterial infections which includes tuberculosis, endocarditis, then plague and rat bite fever. These are use of streptomycin. Here we completed first line antitubercular drugs in detail. Thank you.